in a while. And of course, we will also be hearing from our colleagues from the SIHI Hub in South Africa, Katusha and Jillian, who will share a bit of what the Bertha Center does and their innovative financing in health work. And after the two presentations, we will open the floor if there are some questions, but more on discussion. So we hope you'll hold on to your questions, comments until all the short presentations are done. And we also hope to discuss next steps and points of possible collaboration before we finish in about an hour. But before I call on Dr. Beatrice Alpap to give the opening remarks and to give us a brief overview of why we are featuring Valcare in the SIHI Talks, let me just walk you through a very short history of SIHI Global Network and who we are and what we do. So let me just share the slide in a bit. And all right. So I hope you can see my slide. All right. So maybe just to start that, I think everyone will agree that we see a lot of medical technological advancements, but the reality on the ground, we still see health systems and services that are offered to millions of people across, especially in low and middle income countries. And we have seen this very obviously during the pandemic, they still remain inequitable. So in other words, health care delivery gaps still exist. And this is affirmed by many studies, including a World Health Organization and World Bank study that says half the world lacks access to essential health services. And I'm sure that for most of us working with communities, we resonate with this. And in the Social Innovation in Health Initiative, or SIHI Global Network, we see this challenge as an opportunity to front-load community engaged social innovations to bridge this healthcare delivery gap and possibly transform health systems towards the attainment and the achievement of sustainable development goals, and of course, the universal health care coverage. And in SIHI, we define social innovations in health as inclusive solutions that meet the needs of end users through a multi-stakeholder community engaged process. So just to mention a bit of history, in 2014, a collaborative undertaking emerged between the Special Program for Research and Training in Tropical Diseases, or that's TDR, as we all know, and the University of Cape Town, the University of Oxford, and the London School of Hygiene and Tropical Medicine. So the Social Innovation in Health Initiative, or SIHI, was developed on the premise that solutions to many health problems can emerge even from communities in low resource settings. So the initiative is dedicated to advancing the understanding and application of social innovation in many of these communities to address health inequities. So it has continuously expanded, as we say, in 2016 until now, to include several country hubs. And these country hubs provide a platform to convene the various health system actors, including innovators, and promote and catalyze social innovations in health through research, capacity building, and advocacy. So in 2020, up to the present time, the network continues to expand and thrive. And just to show this map, currently we have 13 SIHI hubs that are present in 4 regions. We have 6 SIHI hubs from Africa, that's in Malawi, Uganda, Ghana, Nigeria, South Africa, and Rwanda. We have 4 hubs in Asia, and one is the Philippines, and that's where also the SIHI Global Network Secretariat is hosted. In China, Indonesia, and India, we also have 2 hubs in Latin America and the Caribbean, that's in Honduras, and 1 in Colombia. And of course, our newest SIHI hub is in Sweden. So through the network, we endeavor to embed social innovation in research in other countries as well. And the network, as you notice, this is an exciting time for the network. We are turning 10 years in 2023. This is a very important developmental milestone to reflect on our impact and, of course, our sustainability. So today, we will be highlighting Valcare's business model, and we hope that their story will inspire all of us, the SIHI hubs and the network, to consider such approach and model. And as the network moves forward and as the hubs transition to more sustainable business models in the next 10 years and beyond. So, and now without further ado, may I now call on, of course, the Social Innovation in Health Initiative co-founder and the lead for TDR, Dr. Beatrice Salpaap, to give the opening remarks and introduce Valcare and, of course, Ivan Swartz, and to give an overview of why we are featuring them in the SIHI Talks. So over to you, Beatrice.
Thank you. Thank you very much, Meredith. And hello to everyone. And thank you for joining us today. Thank you for the SIHI Secretariat to organize the event. And thank you for her speakers to share with us all their experience. So as a co-founder of SIHI and also on the behalf of TDR, the Special Program for Research and Training in Tropical Disease, and SIDA, the Swedish International Development Cooperation Agency, who have been greatly supporting SIHI activity, we are very pleased to open the second SIHI Talk. So these SIHI Talks are really providing a platform to engage partners and future collaborators to discuss and identify areas of collaborations. And today, as mentioned by Meredith, we are very pleased to welcome a new collaborator and partner, Ivan Schatz, from the CEO of Valcare, a non-profit organization that is ensuring that social efforts are making an actual impact with communities of the Cape Wine Lines in South Africa. And Valcare provides a real interesting, innovative, sustainable model to support NGOs and social innovation. And as we met Ivan and his team earlier this year, we've been very impressed actually with this model that is very sustainable, and you will hear about it. And we were very excited and interested in exploring how relevant is this Valcare business model, maybe for the CI hubs to adjust and see how they could then sustain their activities in the long term. And Katusha de Villiers and her colleague at the Bertha Center for Social Innovation, the SIHI hub in South Africa, will talk a little bit about also some sustainability approaches for innovators through some innovative financing, and for hubs, as the Bertha Center has been now, I think it's more than 10 years now, it's 15 years almost, established and maintaining their own support. So yeah, we'll be very happy to discuss all this relevance and see how these models can inspire the hubs and how we can learn from it. And yeah, over to you all, and thank you again. It's very exciting time.
Thank you, Beatrice. And now I think we're ready for the presentation of Ivan. So Ivan, the Zoom platform is yours.
Brilliant. Thank you. I hope everybody can see me with my extremely shiny shirt. I really want to thank the CI Secretariat for organizing an excellent event. I must say, I was speaking to my team and just so impressed about your diligence and following up and the thousands of emails. So this is a compliment, by the way. I'm not making fun of you, but you can make fun of my colorful shirt. I think to maybe kick us off, because I know I only have 15 minutes and now I'm talking rubbish while I'm busy doing that, is I'd like to tell you guys a bit more about Valcare. And I want to state as from the beginning that, you know, we are a organization that's a learning organization and growing. So we absolutely have just as much to learn today as we have to share. So please, I'm very happy if you've got critique and you don't fully agree with what I say. I'm very happy and I don't offend easily. I'm a South African, so we don't offend easily. So I'm just going to play a quick, I just want to make sure that the sound is on. Sorry about that. Yes, it is on, so that we can just, yeah, give a bit of introduction of what Valcare is.
Every day, thousands of people wake up to make a difference. Some invest in the future. Others give their time, their skills, their talents. Even when things look dark and the challenges feel overwhelming, you will always find the heroes. People who work tirelessly to help others, to grow potential, to improve lives. Nothing can stop what we can do together. At Valcare, we are serious about social change. We connect social investors and funders to credible community initiatives. By partnering with non-profit organizations and guiding them every step of the way, we ensure actual social impact. Through our membership network, we unite and empower hundreds of non-profit organizations to become stronger and more effective. Imagine the possibilities if we all joined forces to build the future of South Africa together. Be part of it.
Great. So as you can see from the video, we are not an exclusive health organization. So hopefully some of what I say will add value, even being a sector that's outside of your immediate interest. So the reality in South Africa, there's a few very horrifying stats, but some statistics with regards to specifically health is in our public sector, only 71% of our public or our population has access to proper health. So that is not a great statistic to have. If we dive slightly deeper, if you look at something like dental, for example, there's one dentist for every 9,350 people. So obviously within that, there's multiple ripple effects out of that. And that's the same for something like eye care. It's the same for something like access to emergency health, maternity health, etc., etc. So I won't go into too much detail. I know I'm pressed for time with it. So but the statistics are why we exist. The reason that we exist is to try and solve a problem. And I think that's quite critical to understand within the different hubs, is that you're trying to solve a problem. And one for any funder or for anybody that's got appetite to become involved or to partner on the journey, I think you have to solve a problem. We have to think a lot more entrepreneurial within the nonprofit environment, and specifically in the health sector as well. Bit of our history is we started out in 1999. It seemed like a good year, I guess. And then initially it was all about building networks. It was all about building a network for nonprofits to engage and to try and work together and to try and take hands to solve various problems. And then in 2017, if I fast forward about 15 years from there, from the initial opening of the doors, we converted into a social impact platform. So what that actually means is that we wanted to combine the two worlds of the nonprofit network that we had built over 15 years and add onto that a funding model. So I joined in 2017, so I cannot take credit for all the hard work that was done before me, but yeah, hopefully I can speak to it slightly. So a vision was communicated earlier, but it's to ensure that we have that social effort as an actual impact. So, I mean, we read 1 million reports a day, it sometimes feels like, and we sometimes question if it has an actual impact. Does it move the needle? Does it really change the world and make it a better place? And that's sometimes a difficult thing, especially from a funding perspective, to address and to measure and to monitor and to have, I almost want to say, the guarantee or the confidence that that actually happens. So that's very much a big part of what we do. And then the two strategic focused areas, I'll go to the next slide that'll maybe show it a bit better, is we always have two main focus areas. The one is the social investor, which I'll get to now, and then the non-profit organization, which we describe as our members. So the social investors are people that it can be corporate companies, it can be family trusts, it in some cases can be government entities, or individuals, anybody that wants to invest within the solution that we are offering. So that could be in the way of funds, it could be in the way of goods in kind, where people donate physical resources. Recently, we had a farmer donate X amount of fruit, and then we can distribute that throughout our network. Services in kind is where people obviously dedicate some of their professional time. So lawyers, doctors, architects, engineers, that sort of thing, that give some of their services in kind. And then volunteers, I'm sure everybody within the sector knows what a volunteer is. On the non-profit organization side is, we firmly believe, like any other investment or any other asset, you would like your investment to grow and to become better. So when I was tasked 5 or so years ago, we really asked ourselves the question, are we going to be an organization that just funnels funding from one point to another, or are we going to ensure that that organization that we are investing in is becoming better and better? So within our nonprofit organization block, we have currently 282 nonprofits that's part of that network, and that's I'll show the different categories now, but that's very vast different. So you'll have a soup kitchen that works within the food security space, and then you'll have people working in health, then you'll have people working in prison. So it's pretty much a bit of a cradle to grave type of scenario. And we feel that it's imperative that these nonprofits become better at what they do. The reality is, like any investment from even government organizations or family trusts that want to make the world a better place, they want to be sure that that organization becomes better. And so within capacity building, you try and address that through various forms of training and strategic management, and even accelerator programs that we have within our spectrum, to see how we can take our organizations to the next level. Coordinated effort is where we group organizations around the table. So for example, for the school, organizations that work within a specific sector. So within the health sector, we'll have a health sector coordinated effort. So in the last financial year, we had 7,117 beneficiaries within specifically health. So that was the multiplication effect of people sitting around the table and working together has been incredible. And we believe that's I guess the secret sauce, if you want to call it, to our model, is where nonprofits working in the same industry start solving the problems together. This is not a great thing to discuss as an example, but we've had nonprofits that work within child protection that's unearthed quite a few, unfortunately, child trafficking syndicates that's working within our area. And that could then lead to prosecution and ultimately jail time and so on and so on. So for us, coordinated effort is quite a central part of what we do. Encouragement and engagement is obviously things we enjoy. People working within this industry is usually quite struggling from secondary trauma and sometimes first-hand trauma, and then also compassion fatigue. So within that, we've got various interventions, but one of it is that we have full-time mental health support. So any of our members can book individual or group sessions with psychologists and counselors to help them with the mental health challenges that they face, them and their team, of course. Support, that speaks a bit to the left-hand side in terms of funding and share of resources, small things as being able to have access to a proper office space or boardroom facilities, printing access, that sort of thing is support that we try and give, and then obviously also all the others. And then awareness and advocacy, we feel we have a central role to play there. A couple of years ago, South Africa, especially Cape Town, was struggling with a drought. So we've played quite a central role in helping to spread the advocacy and the awareness around saving water and making sure that we don't get to a day zero scenario. So in the center of all of this is governance, communication, relationships, and then obviously monitoring, evaluation, and reporting. And there's a lot more detail to that. So I'm very cautious of time, and I don't want to run in that we go over time. But I'm very happy to answer any questions around that with regards to how we try and do things and how we try and establish that. Maybe the social impact categories. So right in the center, you can skip the first three. Right in the center is healthcare. So for us, that's physical and mental health challenges. And it's, you know, in the last 2 or 3 years, the world has changed dramatically from a physical health perspective, of course, but definitely now we're seeing more and more of the ripple effects of the mental health challenges within our nonprofits. And it's absolutely imperative that we find new ways of trying to deal with that and how we can solve that. One of our partners, just as an example, uses play therapy for children to help them to cope with mental health challenges. And that type of intervention for us is a great solution in helping children. That's usually something we feel we'll deal with later, and we just kick it down the road, but it's so critical to start addressing that right away. So healthcare is very much a focus area for us with regards to our categories. I felt I wanted to highlight our partner metrics mapping. That's one of our solutions within our monitoring and evaluation. So I'm sure you guys are very aware of theories of change. So we've got a very strong focus on theory of change. What do we describe as change? What do we describe as what our strategy is in actually moving the needle? What does that look like? So within the partner metrics mapping, it helps us to map our partners and our members that receive funding from us, and then help them to grow. So an example, this is just a bit of a nice slide. It looks a lot more complicated and ugly when we put on the Excel spreadsheet, but for now this will do. So engagement, we feel that networks are only as healthy as their engagement. So it's so important for us that our network and our people that form part of that engage as much as possible. So we rate them on a scale of 0 to 3, 0 being we're only starting out now, there's no communication. Improving is shows intent, growing is this open communication, and scaling means this meaningful engagement, which can translate to them pouring value back into the other members within that network and sharing within the network. Leadership and governance, absolutely hands down one of the most important ones. We feel that strong leadership means that that's multi-generational leadership. It's not one charismatic, strong leader. It's somebody that's looking at who's going to follow him up after that cycle of leadership has gone on. So there's also the stages in that. Sustainability speaks to proper financial strategy. And are they looking at ways in solving the problems that can be sustainable over time? So that's not just money, that's also environmental and all the rest. And then monitoring and evaluation for us, I almost want to say our bread and butter is to be able to report back to our funders and say to them, look, you've given us X amount of money. This is what it's enabled in the last year or in the last quarter or even in the last month. So for us, it's so important that our partners measure and understand what they measure and why they measure it. And that's all of that is plugged into a strong theory of change for all our underlying nonprofits. So, I mean, this is very high level. So I know it doesn't seem that complicated. Within every one of these metrics, we measure and we spend time with our partners. And I would possibly encourage this to the SIHI hubs, that this becomes maybe one of the areas where we can collaborate. So part of what we want to talk about today is how can we collaborate? And I think this model can definitely help in how we can stimulate engagement. Initially, we tried quite a few different models of building network. And the reality of network for anybody, and I absolutely include myself as an individual in this, is there has to be value for me at the network level. I'm not really interested in engaging in a network or in network sessions if there's not value for me at the end of the day. And this helps us to plot out where our partners are at and help them to grow in their efficiency and within their individual models. So yes, so maybe just a bit more on the partner mapping is there has to be structure to that, and we measure that with site visits. So we physically go to the nonprofits and find out how they do things, try and put that out on the map. It's customized for each partner, and that's where I guess the heavy lifting is, and that's where a lot of the work goes into it. And we have a full-time team member that literally just looks after that and tries to get action points after every visit and help the organization to move ahead. We track all the progress that we make. For us, even though we say that COVID was the best and the worst of times, we could clearly see the input that we'd given 3 years prior to that within our partner survival. So the way that they were able to serve their communities and be efficient in times where they couldn't access various resources, for us was a great way to illustrate that there's actually been growth. And it also, for obvious reasons, helps us a lot with funding decisions when it comes to making investments. So if we see an organization does not want to connect with the rest of the network, we feel that the sharing model over time will not add value to the network. And then we will be more apprehensive to invest in that. And I think I wrote an article recently specifically based on collaboration. And it used to be one of those words we talk about within the nonprofit space. We talk about sustainability and collaboration and impact and all these nice words, but collaboration is not even a negotiable anymore. And that's why I love the CI models and the hubs and the contributing partners. It's an extremely impressive slide to look at the world and see all these different partners. There's no other way. If any organization is not interested in collaborating, it's just no way that could work over time. And then I know my time is up, so I just want to show a short video of one of our partners called VisionBox. That's a health solution within the visually impaired space. And these are just one of the models that we've invested in and still invest in within our area, which we think is quite a good investment. So yeah, I'll just play the video.
We have a charity called Project Ata, and during one of our outreaches in George, we were busy fitting a pair of glasses, just normal reading glasses for a lady. She was probably in her 80s. While I was fitting her glasses for her, I asked her just a basic question like, what are you excited about the most now that you get your new glasses? And she said the thing she looks forward to the most is to be able to read a Bible again for the first time in 30, 40 years. And that was shocking because glasses aren't supposed to be expensive, and it's not supposed to be for only a few select people. A lot of times people will come into the practice and they need glasses, not want it, they need it. And as soon as you start discussing with them the normal prices, you realize they can't really afford it. About 55% of the population of South Africa earns less than 1,000 Rand a month. So that basically is not even enough for a basic pair of glasses. So in my life, I've got a philosophy that I always try and look at the bigger picture. So if something's not important in 5 years, I don't worry about it too much today. What about 20 years from now? Did you actually do anything with your life? I believe that optometry and eye care should be a human right for all in South Africa, and that is the main motivation behind the VisionBox. We take qualified optometrists that got good experience. Then we take normal containers that we refurbish at world-class standard. And then we take proper equipment, same equipment that I use in the practices. We go directly to the factories and we import products. It was very important for us to offer a high-quality service at a price that almost doesn't make sense. It's a self-sustainable model, and the idea is for us to have in every community that needs them in the country, have a VisionBox with a young entrepreneur that runs it. The dream we had with VisionBox is to open the first one, which we did in Mbekweni. We've had a few patients that are legally blind. They've got very poor vision, but with their glasses, they've got 20/20 vision. Without their glasses, they can't drive, they can't work, they can't get employment. So the idea with VisionBox is if we can get a portion of the population to see, to hopefully then empower them to get employment and then to grow the economy. I think every single person on earth can accomplish something and they can add to someone's life. I think a lot of time when we dream too big, we want to change the world. We can actually just start by changing someone's world. And you can do it by volunteering your time, donating money, giving advice, but also another good idea is stay in the field that you are expert in. If you are an accountant, maybe offer your services to a non-profit. If you are a lawyer, maybe offer your services. If you are a great sportsman, maybe do a motivational speech. Just do something that you can do and just at least start with something.
Great. And that is my story. I am not sure how I'm doing for time, but I did my best. So Meredith, I'm so sorry if I messed up your program. It is all my fault. Please don't tell our board.
You did great, Ivan. Yeah, you stick with the time. And thank you very much. That was a very impressive presentation. I got struck with think entrepreneurial in a nonprofit environment. So I think we have a lot of discussion along those lines in a while. But before that, let me now call on also Katusha and Jillian, who will be sharing the Bertha Center stories as a SIHI Hub. Katusha, you have the Zoom platform.
I apologize, everybody. Thank you so much for inviting us to present today and to share a little bit about the work that we're doing. I'm going to talk about the Bertha Center specifically, and then Jillian will just talk about one of the projects that we're doing around our health systems in a bit of financing work. Thanks, Jill. You can go on to the next slide. So we're a small team here at the Bertha Center, the Health Systems Innovation Team. It's myself and Jillian Moodley. We have been at the Bertha Center, we've been working with SIHI since its inception. As Meredith said, we were the first hub. So it's always very exciting to attend these talks and see all the other hubs and to see how it's grown over the last few years, the last 10 years. And it's been very exciting to be a part of that. At the Bertha Center, our mission is to pursue social impact towards social justice in Africa. And we do that through educating, researching, convening, catalyzing, and advocating. So we teach, we publish research, whether that's academic journal articles, white papers, or op-eds. We convene, so we pull together workshops, we catalyze, whether that's the work that we were doing with TDR and helping to catalyze SIHI, or with other partners such as the World Bank, the World Economic Forum, Johnson & Johnson, and as Jillian will discuss later, the South African Medical Research Council, and then through the advocacy opportunities that we're able to advance and participate in. And we do that all with a systems lens on social innovation. And the through line through all of that is that social justice aspect. Jill, you can go on to the next slide, thanks. So within our health systems innovation portfolio, our focus really is on trying to frame an approach to healthcare innovation in Africa that is specifically geared for Africa. So there is this understanding that we subscribe to, that real health needs and the belief that social innovation for health is a mechanism through which we can move closer to achieving health equity. And that is really our focus through all the projects that we do, is this understanding that health is not purely a biomedical issue, health is a social justice issue. So that really ties into the work that we do in the Bertha Center as a whole. So the health team is only one of the teams that we have. We also have education, youth development, innovative finance, and then, as I said before, systems justice. So while we're just a small team, we are very lucky to be able to call on the expertise of the Greater Bertha Center, and there are about 25 of us, which is great. You can go on to the next slide, Jill, thanks. And our portfolio objectives are fourfold. So we look at creating and promoting spaces for social innovation and health. We mean, by that, we mean physical spaces, such as the Social Innovation Hub that we set up at Groote Schuur Hospital, which is the teaching hospital affiliated with the University of Cape Town and Faculty of Health Sciences. And there we created a physical space and an innovation program. It was the first of its kind at a public sector hospital within South Africa. We also identify and drive new funding and financial models for health, as Jillian will talk about later. We do a lot of researching around how health systems are changed. For example, another project that we're working on at the moment is with the Bayer Foundation and the World Economic Forum. We're looking at, we've taken the year to look at how COVID-19 has impacted health entrepreneurs across sub-Saharan Africa and pulling those actionable insights out to develop a report that will be launched in Davos in January of next year. And then we also look at developing advocacy opportunities around social innovation and health. So as I said, we have been a part of SIHI for since its inception, but Bertha has been around nearly 15 years. And we, just to touch on what Beatrice mentioned before about sustainability, we were lucky enough to be founded by the Bertha Foundation. And we have received core funding from that organization through the entirety of our life cycle. And that is, I would say, quite unique and makes us very lucky. It gives us quite a lot of cushion because we don't have to worry about, funding those core operational costs. And then we're also able to pull in additional funding through specific projects that we work on. So funding that we might have received from Johnson & Johnson to better understand health entrepreneurship, or funding from Bayer and the Schwab Foundation to understand what these actionable insights following COVID look like, or funding from the South African Medical Research Council to look at what it takes to create a new innovative financing mechanism. So when Beatrice asked me to share a little bit about how we sustain ourselves, those would be the two main areas where we have the luxury of core funding that keeps the Bertha Center going. And of course, we sit within the University of Cape Town's Graduate School of Business. And then for our individual project work that we go out and we solicit funding for, whether that's based on the personal relationships that we have within our own networks, or whether we're responding to calls for proposals, or whether we're, researching possible partnerships and connections, and then reaching out through that. And what I will say, which has been incredibly helpful, is that we have a funding consultant, a fundraising consultant that works with us. And I would recommend that for all of the hubs who have this at top of mind, is that this person who is then able to alleviate some of that stress, because it's very time consuming to look for fundraising. And I see also that we need to wrap up. Sorry about that. So I'll turn it over to Gillian just to wrap up for us. Thank you.
Thanks, Katusha. Yeah, just very quickly, I work on something called a social impact bond. This is in collaboration with our partner organization, the South African Medical Research Council. So social impact bond is not really a bond in the sense of what you would think in terms of finances. It's an outcomes-based contract. So people are measured by the results that they perform out in the field. So the mechanism works like this. There's an institution that commissions this outcomes, this SIHI, and then there's a private investor who provides the working capital to organizations to set up mobile clinics, get equipment on the ground, for example. Then you get a service provider who's usually an NGO that provides the service to the beneficiaries, and the government who provides outcomes funding. So only when the service provider hits their targets, then the private investor gets a return on the initial investment from the government. And then there's one organization who's playing an intermediary role. In our instance, it's the South African Medical Research Council who's facilitating the contracting and engagement between all the other stakeholders here. So the Imagine SIHI targets adolescent girls and young women in 2 rural districts in South Africa. So we are giving them PrEP for those who are sexually active but HIV negative, For those who are HIV positive, we're initiating them on ART. For those who are sexually active, we are also giving them contraception. And for those who do fall pregnant, we create access to antenatal care so that they can go for their checkups. So the challenges that we faced, mainly it's around relations and getting the contracting on board and the approval process. So the South African Medical Research Council is a government entity. So there's a bit of regulations, compliance, public finance management acts that we've got to work around. And there's a bit of bureaucracy and relational work that comes with that. There's also high development costs that are incurred, which brings into question the cost effectiveness of an innovative finance mechanism like this. And looking to the future, we want to create a pipeline of these types of transactions. So we are already conceptualizing one around drug-resistant TB and the psychosocial approach of that. And then, we want to work with the National Treasury to create a more conducive and enabling environment for more of these transactions to take place. Thank you. That's the Imagine SIB in a nutshell. Thank you.
Thank you, Katusha and Jillian, for sharing all those innovations. I think Katusha has also shared how Bertha Foundation has sustained over time from the beginning with the co-funder, and that's their model. And of course, the financing part also of one of their projects. So we have a bit of a time to discuss these models, and there are comments and questions in the chat box which can jumpstart our discussion. I'd like to start with what Beatrice has commented in the chat box in regard of trust fund and to support NGOs and helping them to communicate and conduct M&E, and this is in the context of Valcare's model. And these are great ideas for collaboration. And there's a follow-up question on how feasible is this for the hubs to adopt. Would anyone like to comment on that? And I think Joe has also started a comment in the chat box.
Can I maybe jump in if that's okay?
Go ahead, Ivan, please.
Just mute me if I should keep quiet. I think what I mentioned right at the beginning is I think it is important to solve a problem. So it is almost impossible to speak around getting funds for something, whether that is a local funder, international funder, government funding, if you don't really solve a problem. And I think the theory of change is critical to that. So out of the theory of change, the M&E structures will flow. So data that flows into the theory of change will then flow out within an M&E reporting, and that cycle closes. I'm sorry, I don't want to talk too technical, but that's one of the critical tools. And speaking to multiple researchers, I'm sure that you guys would understand that. I think that is very important. There was also a question about setting up a local trust fund. I think that is quite critical. I think we are similar to the Bertha Foundation or the Bertha Institute, is that we have local funders. So if you have local buy-in, once you then reach across borders, whether that's international borders or provincial borders, it becomes slightly easier because you're endorsed locally. So we started like that as well, where we had multiple local businesses and family foundations and individuals saying, look, we trust what these guys are doing, and locally we support them. And so part of my job is also fundraising. And maybe a consultant is not a bad idea, Katusha. I think you're right. It's not the greatest of jobs, but I think it's critical because, but I can sell something because locally I've got endorsement. So I think for all the hubs, that would be imperative, is you have to get local buy-in before you go across the borders to find money.
Yeah, good point, Ivan. Thank you for that. So we are just also talking about how important it is to, have local buy-in and have local funders support the work of the hubs. Okay, thank you. That's an important point. So Beatrice, you want to jump in on a follow-up on that discussion?
Well, thank you, Katusha and Jillian and Ivan. And yeah, I'm quite interested. It's quite interesting to see and imagine, like, if the hubs could maybe first develop a network local donors and develop trust, like was said by some, and then possibly see with them how, because I see a win-win situation in the Valcare model is that the donors were previously giving to each individual NGOs, but they had they couldn't really make sure that they don't overlap or synergize or do effectively their work, because it's time consuming. So Valcare suddenly, by setting up the trust fund, get the funding, and then support this NGO to do the proper quality assurance, as well as theory of change, but also the research to do their impact assessment, to showcase their value, and that is something that then for the donors is easier. For Valcare, they can continue do this because of the trust fund. They get some funding to operationalize all this, and of course the NGO, they get better and better and more visibility. So it's like win-win-win situation. But how does it take to make people see this? That's the difficulty, because I see the hubs are really important in playing all these roles, but the impact comes from the social innovation. So the model is, how do you show that actually the hubs can provide great added value in embedding research in social innovation, and therefore funding through this trust fund is a much better option. So that's a bit of when I heard about the Valcare models, like, wow, this is something that potentially could work, and how to make the mayonnaise tart is really what is to brainstorm still further, I suppose. And there were already some nice little hit in terms of trust, in terms of start local and these types of tips. So yeah, over to you, Meredith.
Yeah, thank you, Beatrice. Those were important points. And we were also thinking, so this is a win-win model, but it should be clear how the impact will be shown, because what's the significance of the hub as the middle, what do you call that, middle person in all this, because we don't directly show the impact, but we're somewhere in the middle, providing evidence that these social innovations on the ground work. And yeah, it's a tricky thing to be able to show that, and have the buy-in of partners. And I guess in the next 10 years and beyond, that's the direction of the hubs, proving that this has impact. And and I think collaboration across, whether local or international, is also very important. All right, so there are some questions also in the chat box that I think some were addressed, some were answered already. And let me just see. All right, so yeah, research supported by SIHI hubs can help demonstrate innovation impact. Definitely. So there's, I think, 2 questions about the vision box, and there's an interest there. So there's a specific question. Is there already evidence showing impact, and has this been replicated? Maybe Ivan can shed light on that.
Yes, so on the first part, absolutely. So the second vision box is, well, I can't show you now, but because I've got a very fancy background screen, but it's just literally outside of my office, so it's quite in the central part of town. And the model is quite critical. There's a big gap, a profitable, scalable gap that can be closed, I guess, with the model. So it's not something where they are cutting corners with regards to the model, giving a cheaper quality. In fact, the glasses that I'm wearing right now comes from VisionBox. So I think the reality is it's a model that can work. There's obviously an initial setup cost, but then the model itself can sustain itself. The reality is that a pair of glasses at that level is so critical for economic development. So it's touching so many multiple other levels of that. So what's currently fun for us to invest in is eye tests for children with regards to schooling. So that again touches the whole education space, and then being able to address that. So it becomes a bit of a, I want to say, a light in the middle of quite difficult circumstances to have multiple enablers within those communities. So it's not just sight, but multiple other levels of economic activity, educational activity, becoming better. There's a few other videos, again, we don't have time, but people function within their job so much better because they can see, and previously they just couldn't afford the glasses. So yes, the model can work. It is a container. I'm sure that containers are all over the world, but it is important to make it a high quality product. That I think is what makes the model different. It's not a second-hand sort of product. It's a proper healthcare facility that anybody can walk into, and utilize. So yes.
Thank you. So I think that answers the question in the chat box. And there are also some who are asking for a copy of the presentation, if that's all right to our presenters to share this. Okay, I see a thumbs up from Ivan. Thank you. And probably in the last few minutes, we would like our concern now in the network. Of course, we've been talking about sustainability moving forward, and Valcare has shared a very good model, and Beatrice has cited a specific one on what they do in Valcare, setting up a trust fund. And when we had the meeting, this was also our discussion, and also mapping some local funders for buy-in. So I think this question is important. What would it take for SIHI hubs to manage or set up a trust fund with local donors? And I think before any of the hubs would think about this, we can also ask again, Ivan, how did you manage to set up a trust fund? And yeah, how did it start? So maybe we can learn from your experience in Valcare.
Yeah, so when I say trust fund, I'm thinking about my 5-month-old boy and thinking that I should invest money for him. So thanks for the guilt trip, everybody, and saying the word trust fund. It sounds extremely fancy, and it sounds extremely expensive, and it sounds almost unachievable. But we started with a small group of people that wanted to make a change. And then what you need 1 or 2 funders to buy into that vision, and that gives you legs. I mean, our organization is 20 years old, so it's not something that happened overnight. All our core funders have reduced significantly in the last 5 years. And the reality for me when I started is I never wanted that to happen, because we just want to grow and scale and become bigger. But it's important, and it was touched on a bit by Beatrice about saying that, you know, you need multiple people feeding into that, because it manages risk for you. So if one business that's funded you all, for the last year is not profitable that year, then your operations fall flat. So you have to diversify your funding sources, but that happens over time. So when we started, it was 3 core funders that started out with us. They clearly indicated that they are going to reduce funding over time. And then we knew that a very big part of our focus is to prove the model and then start almost selling that to other funders as well, because we were solving problems for funders, because funders don't want to sit with all the work of building relationship, monitoring and evaluating different organizations, making sure they've got impact, sitting with various unfortunate manipulation and some difficulties in terms of emotional manipulation and so on. So we were trying to solve a problem, and you can't get away from that, unfortunately. And so my advice for the hubs would be get 1 or 2 local funders that's bought into what you're trying to do, or that one social innovation that you want to drive, and then do that really well, and then use that almost as an example or a proof of concept to start getting other funders involved.
Thank you. So it makes sense. So maybe we can, that's a very important lesson for us. I think some of the hubs have already started doing that, but I think for some of the hubs also, this is something new. So let me just connect it to what Bertha Center has been doing also, and maybe I can ask this question to Katusha. How did you end up with the co-funding from Bertha Foundation, and how were you able to sustain that level of relationship?
So I think it really is about the power of relationships and network. And that's really what happened, which is that our former and founding director, Francois Benici, who many of you might know, happened to have a lunch meeting with Tony Tabatsnik, who was the founder of the Bertha Foundation. And they hit it off and together developed this idea of the Bertha Center. Now, the Bertha Foundation actually funds a lot of activist work, whether it's activists or journalists or filmmakers. For example, right now, they every year they run a Bertha Challenge. This year, it's about water security and water rights. So you have activists and journalists and filmmakers and writers who are all working around this issue across the world on water and access to water. And then he was very taken by the idea of creating a center in a business school that would be almost a Trojan horse to help introduce this concept of social innovation to MBA students and give them another perspective. So that's how we fit within the model of the Bertha Foundation. And they've been our core funder since the very beginning. And the reason they've stayed our core funder is because of these close relationships, personal relationships that we have with them. And that has been really a boon for us because it frees us up to then look for other opportunities and funding for other projects. So we've been very, very lucky.
Thank you for sharing that, Katusha. I think, the importance of relationships to the network is very important. And I agree with what Uche just said in the chat box, that the idea of engaging a fundraising consultant is probably might be very relevant for most of the hubs and may be useful in creation of the local trust fund. Thank you for sharing the model.
If I could just, I'm sorry,
Sure.
if I could just comment on that. I do not like fundraising. I find it very stressful. I'm sure that is not unique. I'm not unique to this audience. I find that it's embarrassing asking for money and, and then you start getting in, you become very self-conscious, but then you have to get out of that mode. You're not asking for money for yourself. You're asking for money for a very important project and very important work that you're doing. So being able to remove yourself as the center is very helpful. But then also just having someone else who takes that pressure off you to look and to think of who you haven't reached out to, because it's incredibly time consuming to fundraise and to write proposals. And the other thing, thanks, yeah, exactly. The other thing that the fundraising consultant has been helpful for is that they write pitches for us as well. They interview us and then they write it, and then you can just tweak things a little bit. So again, it's that alleviation of that admin burden has just been incredibly helpful. So I can't recommend that enough.
Thank you, Katusha. That was very helpful. And yeah, before we end, I see Uche's hand raising. So Uche, yeah, please.
Hi, Meredith. Hi, everyone, and congratulations. This has been really exciting, really exciting. Thank you. My suggestion is that we do not close the session without having, without agreeing on a timeline. For example, for each of the hubs to try and get, to try and create a local trust fund. And if we can task ourselves with the suggestion from Katusha to have a consultant, and then task also ourselves and say, between now and next year, when the SIHI will be celebrating a milestone, let us all agree on a deadline when at least the hubs should try and first engage a consultant, secondly, try and create a local trust fund. That's just a suggestion, Meredith, and I think it might help us to put a lot of energy in fundraising. Thank you, and sustainability as well. Thanks, Meredith.
Thank you, Uche, for putting it more concretely. And yeah, maybe we can definitely discuss that as ways forward for the hubs. And I see Michael's hand raising. Michael, please.
Sure. Thank you very much for giving me the opportunity. I think thank you to the presenters and to the organizers. I think we saw various ways in which we can also strengthen the TDR hubs and the sustainability, the opportunity to grow towards sustainability. This is part of our SIHI endeavor to make hubs sustainable and to support their. We can't do the work in their place, but of course we can try to learn together some of the innovative funding possibilities, and this includes crowdfunding, the linkage with the community, with the enterprises in the community, and so on. And there is, I think, SIHI is developing a sort of a course or something in this direction. To try to pilot such things in a hub or two. I think this is the best model. We need to pilot something, but we also need each hub to think independently what is feasible in their context, because we can't bring a consultant who doesn't know the context and who doesn't know the operations of the hub, what their added value is, and so on. The consultant could maybe tell you generic things that you should look for, but you are the best fundraisers for yourself. And I think this will come out through the course that we will see developed eventually. Thank you.
Thank you, Michael. So those were, I think, enough. What Uche and Michael just shared were actually the synthesis of what we have been discussing. I'm aware of the time, so let me just wrap up for 1 minute. I think what we do here in SIHI Talks is to give suggestions or recommendations, business models that work for sustainability. And I agree with what Michael just said, that it's up to the hub to think for themselves which ones of this would work in their context. So what has been mentioned, we're co-funding, a consultant for fundraising, a trust fund, even crowdfunding and piloting all this. And I agree with Uche that maybe we can set up a definite time from now on until which date we agree. And just to say that the Secretariat is also organizing together with TDR in-person partners meeting in 2023. So maybe we can look at that timeline and continue the discussions in the next SIHI Talks. But we thank you very much for staying on and for the very interesting things that Ivan, Katusha, and Jillian has shared, and of course for everyone's participation. And thank you very much for joining today's SIHI Talks. We'll see you again next month for another SIHI Talk and another discussion here in this platform. So have a nice day, everyone, and thank you for coming.
Thank you. You too. Bye-bye. Take care.
Bye-bye.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you. Bye-bye.
Great talk.
Bye.
Bye.
Thank you.
Bye.
Thank you.
Bye, everyone.
Thank you.
Bye-bye.
Bye-bye. Bye-bye. Thank you. Thank you, everyone. Thank you, Mary.